Yeah, so Shep, thanks for having me on. Obviously, a single dose would help a lot. I think one of the questions that's less clear is how much stock is of the J&J vaccine do we have? There are some reports that it has not gone as well. Production has not gone as well. But either way, look, one dose as a vaccine is so much easier to administer. Obviously, you only have to give half as many doses to cover the same number of people. I just think it would be a really good piece of news for this effort.
The president is promising to vaccinate 300 million people by early fall. So at what point can the states start making decisions about opening up businesses and economies?
Yeah, I think that's going to have to be driven by how things are doing with infections. And my relatively optimistic view is that we don't have to wait till the end of the summer or even beginning of the summer, that by late spring, if enough people have been vaccinated, you're going to start seeing case numbers really come down a lot. And that'll allow us to start opening up the economy a lot more. So we don't have to wait, and we just have to make sure that the infections, the high levels of infection we have right now, that gets better. But I suspect that will in the next couple of months.
We've all been reading this new release from the CDC, a study today showing that with the correct precautions in place, masks and social distancing and all the rest, that COVID spread in schools is very low. We've heard it again and again. Is it time for careful, widespread opening of schools across the country?
Yeah, Shep, absolutely. And you said the magical words. You know, we've had this sort of almost at times what feels like a comical debate where one side says, just open up everything, don't worry about it at all. The other side says, schools can't be made safe at all. What this CDC report does, really based on all of this careful data we have, is if we do smart things, if we get kids and adults to wear masks, if we have a reasonable amount of ventilation, we can open up schools safely, and they will not be sources of infection for people who are there, adults or kids. So we clearly can do it, but we've got to do it with those measures in place.
Man, it would be crucial because kids are missing out on so much. What do you say to those teachers, maybe ones who have comorbidities or who live with elderly parents? What do you say to them and about their fears?
No, I completely understand the fears. And I think what I would say to the teachers is that we know how to make schools safer. We know how to do this in a way that does not put them at risk. I don't think any of us feel like we should be getting kids back to school if it's putting teachers' lives at risk, and I think we can do it without. And there are additional things we can do on top of this, putting in some testing and making sure that we have good follow-up for any kind of positive tests, et cetera. There are things that school districts are doing to add an extra level of confidence. I think that's a critical part of getting kids and teachers back to school.
Get them back. Dr. Jha, thank you so much. Appreciate your time. Shepard Smith here. Thanks for watching CNBC on YouTube.